And so trying to figure out the best way to debrief staff as to discuss the topics discussed today. And but we do have our quarterly med staff meeting coming up in the summer. So we will find some time there to debrief where appropriate. So that is all by the data short. Right today. That's all I've got.
Okay, thank you. Are there any questions for Dr. Calvin?
Oh, sure, the bowling for the
So,
Well,
it was,
hey, you're showing.
proved to be the best. Eric McClure and his wife Jill, we were kids then, but I like the great turnout. As far as the foundation is concerned, I don't know if basically anybody's gonna report on it, but, we had a ball. It was a hoot. And it's more fun when you don't really, you're no good and you don't really care, you know, Mike did an amazing job and all those that helped him. So kudos there, for sure. But that was fun. That was fun.
So just excuse me, did you say that in your initial opening statement there was concern with the?
No, interesting.
Any other questions? Okay. I know we used to approve the agenda, but I might call him on if it's okay with everybody. I don't see, unless it's, hold on,
He's on his way.
he's on his way. Really, just find that, one more, just go to the next one and come back. So we'll move on to, let's see, what's next one here. Yep, go ahead. I'll take that.
I'll stall for a minute. It'll be brief. Quality starts on page 99, just an overview. Everybody's metrics are looking great. Not a lot of changes to what they think is important to be pulled out. We're sort of looking on switching to the system to track these things, and it's caused some of these numbers to combine where they should see the two different like fall rate, say that looks like there was a lot more fall, but it should be the same place, which is I think all of them thinking that I look at it. Just all of things with the things people here look at and level of expertise that they're trying to take it off. Nothing that we're liking to see.
Questions from the board?
We skipped that.
Yeah. Yeah, I was gonna say, I don't know.
He's on his way. He left later already.
Yeah, it's no problem. Any question on the quality reports that was presented? Okay. Well, then.
Yeah, sure.
You want to do the compliance metrics and technologies?
So, Ted, you talked about the provider-based clinics, being going wrong for sleep lab. I think they're working on that, getting that fixed. Compliance, there were some different things, but 7 of them they're still resolving. One was a violation. It was a self-access, so they accessed their own chart. And I'm not supposed to do that. Anyway, they had a conversation with the employee. He used my chart, so they're taking care of those. Talked about the casino updates, Ocean. We had a safety survey a few weeks ago. They did speak about exercise for the 5 years, and that was good. Then Chris talked about security, different things going on there. Talked about phishing emails, no before training, and talked about Epic. And cybersecurity insurance, we increased our cybersecurity insurance to 10 million. This covers ransom control. It was 5 million, so. It's my report.
Any questions on the flexibility and technology report? So I've got maybe just a couple, and I apologize, I know it's mentioned in our finance as well, but I don't quite understand the billing issues that were with the sleep lab. Is that something that, is this a place or is it better just that's when we look into finance?
No, we can talk about it. So, we had IBM, who does our cost report as well as our audit. We had them do what's called a revenue audit. Hospitals, most hospitals is 3 to 5 years, especially after you do conversion with the new EMR system, which we had a couple of years ago. And to my knowledge, the organization had never done a revenue integrity audit, but revenue integrity audit says it just makes sure that billing is accurate, documentation is accurate, the flow of how somebody documents codes, puts the codes on the bills, sends the bills out, make sure that we're compliant with how we're doing, because the organization does have a level of risk when it comes to accurate billing, contractual risk with our commercial engineers. And it also, you obviously don't want to underbill, you want to overbill, you want to have it accurate. And in this audit, it was discovered that since 2005, we began sleep lab services. Sleep lab is located in a building right across the street from the main hospital. Here in Lower. And so that building is not, the construction level does not meet provider-based standards. Okay. So, the hallways, everything like that there's a different construction standard for provider-based versus standard facility. And because that service is not in a flat file, we cannot utilize, we cannot bill for provider-based for the deployment. Which we can since 2005. And so in discussions with our Bailey, they recommended that we make those adjustments. Austrian work for some form of we were going to come in anyway. But then we had to come up with on a go-forward basis, different solution that would allow us to be compliant. So your 3 options are: 1, you provide sleep lab services; 2, you only bill according to a freestanding facility; or 3, you either fix the existing building or move the service to a provider-based area. We chose option number 3. And so right now, the sleep lab, we can sleep labs, and there's a couple of rooms in our med surg wing that are used for storage. We can use that location to actually do sleep studies. That's to rectify the problem. But there is a mea culpa that we have to disclose, on our cost report. And then going forward, that risk has been removed.
So that's why here is a compliance issue.
That's right.
Right.
And then, just out of curiosity, was that revenue analysis, is that something that was done across the whole organization? And this was just the one piece that was found to be maybe non-compliant, or Was this a targeted revenue analysis by, does the revenue analysis happen by the department on a periodic basis?
You're absolutely correct. It was for the entire organization. So we spend 2 days speaking with every single department, going through, asking the right questions. We haven't received their final report, but because this was a compliance concern, we had to deal with it.
And the other question I've got on the cybersecurity side, I'm just curious, because we've been getting some sort of information bombs being dropped on us in our industry, if you will. The FCC just announced, like for our industry, the FCC just announced that they're not going to certify any like Wi-Fi routers, internet routers, unless it's made in America from cybersecurity perspective. And that's a huge change for, like, and we have to go through and replace equipment now to be compliant and get FCC certification. But I'm just wondering if in this industry, you've been hearing anything of ways around, because I know this is a national infrastructure issue that's happening in power and hospitals tend to get rolled into that. I'm just wondering if anyone's heard anything about American-made electronic network related.
Great question. I have not, but I'm going to defer to Chris to see if she has anything on your wires.
Nothing. Fine.
Okay. And it may not affect you the ways it's affecting us, but I do encourage you to keep your antenna up on that one, because that's going to be a big process of your change. Totally. So in the case of like, so you're a subscriber of ours and you have a router equipment to your home, there isn't right now. There's some questions on the interpretation. It doesn't appear if there's something in your home that if I have network equipment that is distributing the internet service to your home, yes, I have to replace that. And then anything new, if you were to subscribe tomorrow, it has to be in American. So even it's not that, yeah. They're going through a certification process for some other approved manufacturers, but now it's all FCC won't. FCC has to certify certain equipment for use of communications networks, and they just said they're not going to give a certification in this area. So just someone to keep your eye on the right and see that affecting the network. It's not using their equipment. Well, okay, thank you. I'm going to gladly turn the agenda back to you. And just so you know, I really butchered it. We got all of it is. So where are you at? We still, yeah. Yeah.
I'm good with that. My book won't even come up.
We skipped finance and construction and we did quality and finance and ethics and.
We got a foundation for it. It's not maybe people there.
Johnson here today. Was there a meeting?
I would be happy to provide short.
Would you?
Information.
Great.
The foundation board met last night, at a conference you can help on, and we discussed, coming, goals for the year. Would be, actually, the board asked me to ask this board to provide some ideas about fundraising for the coming year. They're interested in knowing what you all want, fundraising activities, and what you'd like them to focus on fundraising. We appreciate a little bit of guidance there. I can report that our bowling fundraising activity, it was an opportunity really to take advantage of many of our vendors who we work with. We were generous to sponsor the event. We had 36 bowlers there. Had a really great time. We actually had the foundation sponsored the free matinee for the littles of the hospital staff. So we had about 90 kids at the theater to watch Zootopia 2 at 10 a.m. on Saturday. I really enjoyed that. It was really fun. We served breakfast and lunch to the bowlers. Really, anybody who was hungry got some food. And we were able to raise nearly $3,000 net for just a few weeks of preparation. And so that response reported in today's newspaper where he gave a little bit of a broad women's services with those funds raised in that for the services. That's the free mammogram program for the or the 13 and UOB program. He wants to sponsor that. The board was very supportive, and the staff were all very supportive of the event. Everybody wants to do it again next year. So we're excited to continue that again. We haven't done it since 2019, since pandemic. So it's nice to resurrect that. We're now in the planning stages of the annual Golf Classic, which will be on June 12th. And we'll be contacting all of our potential sponsors in just the next week or two to be sure that we have reached out to those who are interested in sponsoring that, too.
Okay, any questions?
Oh, absolutely. Good. Thank you.
There is a question.
If I may, Mr. Chair, the foundation board has for several months been wrangling about the need for the upcoming need for a foundation executive. And over the last several months, the board's gotten more and more. What I was putting this way, they might get to work on finding a foundation executive director for us. So over the last few months, we've taken the opportunity to call for resumes and interview. And I guess really the point of all this is we need to really focus on the opportunity for joyful giving that exists in our valley, more so than we ever have been before. In the past, this position has had kind of a dual focus. One focus is community relations and marketing to a large degree. The other focus was foundation and fundraising. Well, as you can imagine, which is more fun? The marketing side is a lot more fun. So having a split position, it really, the fundraising did not occur the way it potentially could have. This goes clear back to the early days when I was originally employed at Star Valley Health Bank. I was given the responsibility of marketing and foundation. It's really hard to focus on fundraising when you got to worry about marketing too. And so the foundation board said, hey, we want an executive director that can focus on fundraising and not worry about the marketing. And so that was their desire. I spoke with Dan, Mr. Ordina, about this. We decided that it should be a single position. So actually, Mark Taylor's position has not been backfilled. Catherine Myers in marketing left the organization a few weeks ago. We have hired marketing specialists to work with Dan Henry, who's our marketing director, to cover many of the duties that Mark did, as well as Catherine. So we have a marketing position. We interviewed strictly for a foundation executive director position to focus on fundraising. And we interviewed several really great candidates. And it came down to, the, one of our internal candidates actually, was selected. It's Ally Nilsson, who is, currently the recruiter. To begin with, she will have time. So here I am, now saying serving two gymnastics. For a few months, she's gonna work half-time as foundation director and half-time as a recruiter until HR is able to recruit. And then at some point in time, Ally will go full-time as foundation executive director. During that transition period, we have asked John Gallagher to mentor and bring his playbook for fundraising that he created at St. John's, which is super successful. He's going to help us, help Ally do a better job than we've ever done in the past with fundraising and contacting philanthropic donor opportunities, making, creating relationships around the valley. Because there is a lot of money in Star Valley, we just need to go find it, right? And so we feel like, with John's mentorship and Ally's exuberance and her outgoing personality, we're going to be successful there. And the foundation board has kind of said, hey, our expectation is you earn your salary times 4. And that's the initial goal. But we want it to be a lot more than that in the future. St. John's raises $6 to $10 million every year, kind of on autopilot, because of the programs that John created a few years ago. So we really feel like we have those opportunities here. Maybe not to that large of a number, but in Star Valley, there are opportunities to raise funds through the foundation to provide for capital needs for Star Valley Health. So that was a long-winded explanation, but I just wanted to let you know where we're at.
Okay, any questions of Mike?
Did John, give us the deal on the mentorship?
Yes, and we, as a matter of fact, I have a contract here signed with him that would go for 6 months. And then if we feel like we need more from him, or it's not working out, we can sell the contract or extend it from the 6 months. But he's given us a really good deal on his work with us. He'll be down here every week. He'll be on the phone with Ally every day, building this playbook, how you go about fundraising and building the foundation blocks.
My question is,
So
how much is this 6-month contract?
That's $4,000 a month.
People that foundation.
No, it will be paid for by Startup. There's been a lot of discussion about
What is the foundation?
There's been a lot of discussion about that, Mr. Chair. And again, our goal for fundraising is the executive director's salary times 4. And if that doesn't happen, Dan and I both felt like we really got to give them one good honest try to really build our foundation. And I'm not sure we've done that to the degree that we should have in the past, because of the kind of dual focus. I met with Dan and Jeremy Larson, the board chair at the foundation. We met with Dan and we talked about how this should be funded. I guess my opinion, board members, is this foundation board cannot do anything without this board's approval. Everything that board does is directly tied to Star Valley Health. All the funds they raise, they can't spend any money on their own without your approval. They can't appoint board members without your approval. They really can't do anything without your approval. So therefore, and again, with in speaking with John Giller, he said that one of the greatest opportunities that he found at St. John's and elsewhere is when you go to a donor and you can say to a donor, 100% of your contribution to the foundation will go toward this specific project. There are no overheads in your donation. Your donation will go specifically to the project. And he said that is such a great selling point to potential donors. So Dan and I both felt like, okay, here's the last opportunity to fund this position and really see if we can make it without burdening the foundation with that, knowing they have to carry the expenses. But again, our goal is salaries, John's work, salary of the foundation executive director times 4, that is the goal. So in essence, they are paid for their salary, but initially, we felt like it would be good for startup and health to fund that so we can really get going. Because the foundation's finances right now, most of the foundation's funds are tied up in an endowment. And so those things can't be spent. Those generate interest every year that we spend, but the currently funds in the endowment can't be spent. So we just felt like it was the right thing to do for Star Valley Health to fund this position for a period of time and really to give it an opportunity.
But
Yeah, just trying to just make sure I understand the function of what we're doing. So if I'm following, the message is 100% of your donation goes toward the capital project. Is it the intent that Star Valley Health has also been paying the salary of this foundation director, as well as that continue to be, at least for now?
Yes.
So what is the median salary, I guess, I'm just wondering, so what's 4 times that, what's involved?
So it's about $250,000. The half-man salary is about 50,000. So the goal is we need to raise $250,000 this year.
What did John raise back when we hired him for 60 or $70,000?
We raised about $425,000. And that was over 12 months.
What do we raise on average?
It's been traditionally, we raised between $80,000 and $120,000 a year. Really just on autopilot. Not really making a huge effort to go find donors and build relationships and that. So we raised it from $80,000 to $120,000 a year to foundation right now.
I guess my curiosity is when we hired Mr. Taylor a while back, I thought that's, what was it, 5 years ago or so? That was the intent, and it sounds like he did more marketing the hospital, he did more for the hospital than the foundation. Wasn't that the intent when we split that position and we paid that? But then I don't think we actually paid that in the end. The hospital paid the whole thing.
No, actually, I don't believe the foundation did pay
Okay.
portion of
I
Mark's.
recall that.
Okay.
50/50.
So they did pay half there, and did we get any benefit out of that? We were headed down the same course again
Oh, we raised it up $425,000.
by hiring John, not by hiring
No,
staff.
Mark was a good program. So, it's hard to serve two masters, especially for marketing foundation. I think that it's easier to focus on marketing and county fair, those kinds of things than it is to go knock on doors in the airport and help and create relationships and it's just, I just feel like it's really important for us to focus solely on fundraising not be distracted by other things.
The whole goal is to have this situation completely self-reliant by the county. And so we, again, there's no question that this has been not, expectations about fundraising. I think we've underperformed. I think people feel like we've underperformed. And, compared to, when we compare ourselves to like some county university, to, St. John's, we've done some good things, but somehow we're not tapping into the opportunities that do exist in Valley. And, if this doesn't work, if we don't see things happening in the next 6 months, we won't see any progress, then we reevaluate it. That's the whole point is a little bit of seed money to be able to say that 100% is going towards the foundation, to attract the donors. Get the money in place to support this role full time. It's going to be something else. We just got to do that.
Mr. Chairman, I think the goal here is to allow the foundation to really flourish rather than limp along like we have for the last 20 years. We really need to give it an opportunity to create those relationships and that philanthropic income from individuals in Star Valley. And John has got a really great playbook of how to do this. And I think we've identified the right person to learn how to carry this on and really make the foundation successful. Whereas maybe we haven't really given it that opportunity in the past to really flourish like I feel like there's potential.
And so my only question is the shrinking margins. We're adding another administrative position on here. Contract is 4,000 for that's 6 months. That's 24,000 plus the full-time salary is going to be 80 to 100. But 140, 124. So we're about break even with what we normally do for activities. I mean, in today's world, I just struggle with all the non without looking and saying, and you obviously looked at it and said, okay, this is important for the foundation.
Well, it's important to start off though. If we had a foundation like St. John's, who was able to make massive contributions to capital, if we don't have a foundation that can help support us in the future, you're going to see that it's just going to be more and more of a struggle. So we've got to somehow get this foundation to build its corpus.
And I don't disagree with that thought, except we've tried for 20 years, maybe it's half-hearted,
And we specifically tried to John, it's challenging. He knew that it was long, but he doesn't really.
We get more. I guess I'm just wondering is that, do we have a philanthropy in Star Valley? I think we have.
Well, again, I'm willing to try it for 6 months. See what happens. And that was the whole point is all the sentiments that you're sharing. I have.
I'm sure you guys.
That's that. But I think that we've got at least do one more good college try to see if this can actually be supported on its own.
And so the credentials of the gal that we're hiring full time, right? What was her name again?
Well, should be part-timers.
She'll be part time.
So you're going to be part-time recruiter, part-time foundation for 6 months. And
So we're still split. Is that any different than my
Full salary, half of it minus to the foundation, so it's still not quite the full amount.
It's a tough situation because it's not a, it's doesn't justify, you know, my, think that in the conversations with the boards, they don't feel comfortable hiring 50. No,
Not yet. If we see some initial success, then yes, it's time to make a decision.
you know, so the foundation board is struggling to say, okay, well, how we get the necessary help. We're just trying to figure out pathways for the foundation.
No, I don't disagree. It just seems like we're making the same pathway again. Somewhere out there, that is, that you continue to make the same decision. That's something about being insane.
So in the, Mr. Chair, let me, address Jimmy's question.
Yeah,
Bag of tricks.
Yeah, I mean, really, we already had it before, we're gonna hire and pay us more, yeah.
We had John specifically hired to raise funds for the outline project.
Correct.
And that was a major capital campaign project. It was not, specifically, how do you reach the whole community and not just the outline community? His what do you call this playbook, talks about how do you get employees in the organization to be involved in the organization? How do you get positions get involved in making contributions to the foundation? How do you get what he calls friends of the foundation participate? People who donate a minimum of $1,000 a year become a friend of the foundation. You get invited to receptions, and you can bring friends. And he's got all kinds of tried and tested and true things that he has done in the past. Not just at St. John's, but in his previous life in Ohio, where he came from years ago, that are tried and tested ways to raise funds that really do work. And we never tried any of that when we had Help and Outline. It was strictly a capital campaign. We want to raise money for the Outline project. It wasn't a sustainable annual giving from individuals. And so I think mixing that all in really helps us build a funds that come in on a yearly basis from our people in our community, create those opportunities, make sure that people know that 100% of their donations are going to something specific in the project, creating the excitement amongst employees and others in the community that do have will, that need to learn. Okay, if you're giving your money to somebody at the end of the year for a tax write-off, why not start Island Hill? Create those relationships to be able to do that. So this isn't just a capital campaign, it's a whole program that John's doing.
Yeah. So, I guess my question is trying to wrap my head around this. You, and what's your experience on the foundation? Do you find that the donors that have either helped in the past or prospective donors, do they separate sort of the capital goals of the foundation from operational performance and the possibility sufficiently? I guess what I'm wondering is I feel probably the same as management, that this is necessary, that the hospital needs these capital funds from the end and help them accomplish the growth objectives. I just don't know if I'm a potential donor. It's pretty public that the hospital has been struggling a little bit financially lately, and looking at some of the operational performance, I think there has to be some management decisions that are going to raise the attention of the community. And I just wonder if I'm a potential donor, do I have the financial intelligence to look at it and say, this is a capital funding project that I can still trust management to solve the operational expense problems, or does it come across or see the perception that the hospital's asking me from him to donate to make up the shortfalls on operating expenses and subsidizing management decisions? Well, that question gets harsher is I just don't understand.
Let me give you an example, board members. Let's take St. John's as an example. Last year, St. John's lost $19 million. Guess how they made it up? I think part of it was $10 million in foundation raise.
So that's the strategy then of the foundation?
No, not at all. But that's just an example of how the foundation has become a major part of St. John's success in their fundraising activities they do. I mean, it's like capital projects that St. John's wants to accomplish, or the recruitment that they want to do, those philanthropic donations go for those things rather than coming out of operations. And so I think that is something that I think is important for this particular position and for the foundation board. They really become ambassadors of Star Mountain Health, especially the executive director. They're out in the community. They're out making sure everybody's aware of what's going on in Star Mountain Health. They're going to Rotary Club. They're going to Chamber of Commerce meetings. They're talking to people about what's going on at Star Mountain Health to develop relationships that help us land those relationships where people feel like they can give the foundation and their knowledge wisely on capital items. Awesome.
I think the pushback is very justified. In light of the current situations that we're having to deal with, the concerns that you have about insanity, right? I think it's all very justified. I share the same sentiments. What I would ask is we can reverse course. There's not a problem here. But I'm looking for solutions. You know, if I have a viable solution that you feel can make a difference long-term for the organization, I'm all ears. No, there's no pride and ownership here because all we're trying to do is figure out how do we help this foundation to actually, really move in the direction. I think we've come a long way since 20 years ago. I mean, guys, $300,000 of the capital campaign for the outline. It's not chump change. We were just hoping for like $1 million, right?
These are expectations.
Oh, that's it. That's just it. It's like, it's like, what's my expectations? Well, when I compare myself to St. John's, okay, we're not there, but will we ever be to St. John's? So I don't necessarily know how to manage expectations with this community and giving but what Mike articulated is, okay, what about just the small donations on a regular basis? Can we just start there? And that's what's a little bit different than, the big push. Going to your point, Jeff, I would never want the community to feel like we're donating to, save our operational margin. I think it needs to be centered on specific capital items that people can run.
So, and I think that's great, and I agree, that's part of the messaging. I just think for potentially attracting new donors, I do think I agree with you, there's probably more money in the valley than maybe we even recognize. But I don't think that we have the same kind of economic situation with in Jackson where people are looking for places to put it. And so I'm not arguing doing it. I think my counsel is to just maybe consider timing. I just learned as a CFO, no disrespect my banker friends, that you ask money when you don't need it, not when you do. Because the terms are usually much harsher. when you do need it.
That is so true.
That's so true.
Well,
Yeah,
I just think that if you solve a couple of the operational expense issues and start to get momentum,
yeah.
then your timing is actually probably better. I just would hate having pull out a bunch of powder, get ready to fire and load the fire and then have to get wet. Well, we're
No, I think, did the rest of the board members want to say?
Yes,
Okay.
because I empathize with the plan on that thing. Well, it does sound like a diversion of what we were doing before, and our expectations are that I'm like two would be pretty satisfactory, but I think it's a heavy for anybody to come in. Yeah,
Here.
that is all. So,
You know, because in, you know, right now, there's already, with the EMS district,
Yeah, totally.
and unfortunately, you know, we're battling, Misty's list, in elections. And that's tough. That's tough. It's the stuff I've heard already. It's like the misunderstanding and the angst towards the hospital.
Yeah.
And then we come out and we're like, well, hey, let's raise money for the. And that would be my concern too, is we're talking 6 months. Well, it's from now, so if we start hiring now, that gives us till what, September? Is that the optimal, is that the optimal window of giving these people that are like, hey, I gotta offload some money for tax reasons?
No, you know what is, we had been working on this for quite some time, and I would agree, timing is, right. And so, what we'll do is so we can move forward with the agenda. I'll get with Mike and we'll figure out the kind of, okay?
for training, it's like a great time,
Yeah.
but like $3,000 that goes to women's health, that is good for us. People are way happy to see that.
Yeah.
In this, I've read, every classic does.
Yes, Paul.
Some thoughts. So I guess a couple thoughts I had on this is when it comes to fundraising, in my opinion, just one opinion, but I think it's key critical to who you hire as the fundraiser. I think that's going to make it great. And so my thoughts would be that you utilize this time as we're trying to get done to try to find somebody. And I'm not saying that who, that's all it's like we're talking about is that's candidate and anything like that. They've already guys.
Yeah, she was.
So she was a recruiter. She's already an employee, correct? She's the first. Then they're just gonna ask her to split 50% of the time in the foundation and 50%.
No, but so my point being though, is do we know that we can't get anybody with experience? Do we know that and is it, we can't get anybody with experience if we want to hire them right now? Or is it that if we gave it 6 months and if we get someone and, maybe it's not experience, maybe it's just the right personality, but in my opinion, that's, make or break with fundraising.
Or let's move on. I think management's made a decision and you're in your budget. I don't think we have anything to really change. Obviously your account, the board, personal feelings, but I'm not sure that we shouldn't try it.
Well,
What I'm hearing from a financial standpoint, we're making around 120 a year, right, Mike? So the 250 is another 120. We're really trying to double what we already got in consistently, take care of that position. And so, let's give it
but I
a try.
But I want to reiterate that I've heard the board loud and clear.
Yeah.
Okay, on the concerns of it's not any good, right? And so out of respect for, your perspective and your counsel, Mike and Aaron go back to the drawing board on this, okay?
Mr. Chairman, I have just one last comment from me, and that is, clock's ticking right now on someone who can work with the foundation. Because on July 1st, I am not going to be there to help the foundation with the assignment. So the foundation is in a position where they're like, what are we doing? every dollar we raise for, through donations goes to the hospital. We gotta have the hospital board's approval for everything we do. We're in a bit of a conundrum right here, right?
They rely a lot on these hospital for resources, direction. So it is a conundrum, but Mike, let's go back to fun.
But we're still agreeing that wait, it's still high, and she's still training, but this is going her into the fundraising fire, that's, way too many. It's what our expectation for what they achieved 6 months, not.
So when everybody's selling on the market, do you buy them, sell?
We're still up pace for July.
I buy. If people, I think,
So maybe the timing, is the better time. I don't know. I think we leave that up to you guys to figure it out.
no, thank you, though. We appreciate your perspective.
Anything on the auxiliary? Oh, who was at the auxiliary? Is that you, Cole?
Yeah, it wasn't.
You got a
Minute.
report for us?
Sure.
Not very good, though.
Yeah. Right here. Here you go. Yeah.
No, it was a good meeting. Just again, the dogs are really been great to meet with, and honestly, they are very passionate, and I think they're very powerful part of relationship and community. Please go out there, they have circles and circles to go out and communicate, work with. They reported on the bingo night they had and success. I was trying to see. I couldn't remember how much they is from that. You remember that?
Right, we got 32 million follows. That's great.
Comes forward to more in the future. Yeah. That's all I should do.
Okay, I think we're gonna go back to your finance committee report.
Let me do the consent agenda first. Gotta be the consent agenda.
Have to do, set it in the first. Don't think we have to do it. We can do it after his report.
Let me give the report.
Please.
So yeah, we had a good meeting. Here, have no, did have quite a bit of discussion. I was kind of going through a few things here, but, we did, just starting off, balance sheet wise, what stood out, they had, again, where it was at 29 for, in February. There's a number of things that went into that, a couple things that, we looked at and talked about was that, the annual insurance payments, come out in February, which would be, basically 175,000 of the one and 254,000 if we look at the other one. Numbers, but, basically you're looking at a little more than 1 day tax up right there. And that would be paid, so it's going to be skewed just a little bit from that. The other thing we had some issues with, and I don't know, is the situation with the, NPI number, has that been resolved?
Yeah, in my CEO report, I don't know.
Okay, so,
And the answer is yes.
but
But the cash is not in the door.
right, it's, we've been able to file claims. Okay,
Everything is filed.
So essentially though, we were figuring we had about $3 million in claims out there that were held up because of that. And that would be essentially, net about 5 days cash on hand from that to that, lot right there. And so there's that, we did also talk about, there was an incorrect, so basically, it was found in the revenue integrity audit, that there was incorrect billing code, on sleep lab. And correct me if I say it's wrong, but basically, I believe it's about
I think we've already got this on that. Is that right? So you can move forward.
Yeah, so, and then we have, The amended cost report, I know it said that it's supposed to be done this, or by this meeting, as it been done, and then we got it.
So everything's been submitted, and the person working on it has submitted the first reading the audit firm, and so we're just watching emails right now, see if we can get feedback, but I think we'll get feedback for tomorrow, with them, and they can amend 25. And then we prepared the data for the amended 24 to 25.
And we're talking about the meeting, and when we're talking about we were going to give a significant adjustment back, but at this point, we're unsure whether that's good or not.
But because of the sleep lab issue, we haven't covered it, so we don't. They come right up to the city. But we expecting to have a positive impact, but we don't, they will be kind of maintain.
Before you go on, I was supposed to make an announcement and I didn't. We need to speak up loudly. Otherwise, they may not hear us. So, even though I heard you, we probably need to speak a little louder. Not the time to give others.
As far as the kind of over the statement of operations, honestly, February was a little bit of a rough one. From the standpoint that we were showing about a $2 million net income or net loss. And along with that, basically, it took our fiscal year to date, even down to about 3 million, and which has struck our margins as far as from an accrual-based standpoint, is something that we are getting a little bit tighter there. And so it's something we need to pay attention to and watch going forward. Basically, February, my understanding is there was some things played into it. Soft volume in the radiology surgery. We had the OR volume was down in February. Looking at the statistics, that was the lowest case volume in 12 months. And then flat as well on that. We had some unplanned contractual deductions. And Scott, be honest, people will go on from $500,000.
Yeah, so during, early March, 2 weeks ago, we had a interim rate review from CMS. Which basically, is their estimate from the beginning of the fiscal year, July through into February, based on our Medicare volumes. Where they estimated that they have overpaid this to the tune of $730,000. We accrued for some of that, estimating or just anticipating and for the rate being high, but not that high. It's basically their volume would go up in the cost report they're using in 2025 as their model at CMS. That's what their estimate was. We did have a rate reduction. I would offset that as they go forward. That was the incremental pickup that we had to accrue. It's an incredible. We accrued 200,000. We accrued another 200,000. 500,000.
Does that make sense to the one time you had to track over those in efficiency issues, we owe Medicare money. So again,
which going back to the comment I made about our margins getting higher. So when we're talking about margins getting higher, I'm talking about it on an accrual basis. As we're looking at this for a year, it could be on an accrual basis, it's getting higher. The issue with that is it's, if you look at where we're at as far as our lease payments, that payment's going to be pretty close to the one. I mean, we're still above 1.1, but we're getting close to where that used to be kind of our strong in our financials. So the problem with that is it brings to light, there was a lot of discussion in the finance committee about Medicare and growing Medicare population, which does seem to be a long-term problem that we're going to have to address. It's something we're going about. But it's something that's coming to light as a margin stream. And part of the issue with the margin stream on a accrual basis too is if we don't collect exactly everything that we have accrued, then we're on water if we get that much on water. And so that's the concern there. And so there's obviously there's been some talk. I don't know, Dan, how much you wanted me to cover on potential plans. I mean, I know it's kind of early. We talked about there's some things we talked about that could be potentially addressed. How the release and expense.
Yeah, it's been the whole focus of, the last 30 days, ever since, we have recognized this trend. It's not February, guys. It goes back January, where we really started to see it was no government. That's when we said that's weird. Medicare rates or the utilization of Medicare, the revenue is way higher than it normally is. It was high in December. And we figured, well, the snowbirds have to be going home. So it's gonna go down in June, didn't go down in January. Didn't go down in February. And so I would propose that we spend time later today to go through in detail what management is going to do to respond to these 4 months that we've seen. And so that there's a good, robust discussion. We have the context, we have the backdrop. You're seeing, okay, what's really driving this? And I think it'll be a more robust discussion than just trying to address it right now on this report.
Yeah, no, and that's fine. It's kind of like,
Because we're prepared to do that in detail.
and it's kind of like, but just, I mean, that's really what the discussion coming from those. Yeah, I think that's about all.
I have a question. So it looks like we had patient refunds of $250,000 last month. I just wonder where that's coming from. Because when we go to quality matters, television, we're within $400. If they can buy a quote right now, I think it's $250,000 in 1 month.
Just
Scott,
Majority of that was from one payer. It's called Mountain West Co-op.
Mhm.
Kind of getting out of the business with them, balancing the
And we didn't see them saying, hey, okay,
So we can still move the comment in 2000. Pre-approval on certain, so I've seen from insurance, that's going well.
I'm sorry.
Like with the quality project that they did on collecting co-insurance in advance or estimating surgeries, you're looking for comment about.
That part, that's true. But this balance go up, it was
Totally different than that.
a one-time deal. And it's kind of surprising.
Well, we see the number, it's like, it'll be clarified. I can see it, so I'm not gonna give it.
Good observation, thank you.
So one of the things is when we were talking about the Patriot Board, we were down to about 26 half days. They want, where are we at today? 30. We're back to 30. So what we get into increase back?
We can bring requests. We had, yeah, that's, guys, this is a day by day, and I have a watching this, and so we'll get into this more Saturday. There's 6 or 8 weeks since we had a positive day, getting to the, the slowdown in the claims of the one provider, the NPI issue, which has been solved. Then the compression on the margin in January, February, with the mayor's. But the 30 days doesn't include any of the correction with, I mean, if you added 5 days to that pro forma, look at all of the, just the one issues done, so 5 days later. Depression, we'll get into this a little later, but not to get too detailed. The compression's cost us about $500,000 a month. But, so we're standing right now. You want to ask one? I've been on this. Scott talking about that. Revenue. We're, many of us have been kind of surprised by how the volume of business so, it's across the board, it's not business, more, you can say for the last, for the police, I was including OR, having more so that, with my, practices increased, you approve that,
I think we always go through with a lull. It's to be January, February. But that is a moving target. Don't really understand why, as we talk amongst each other, as to why February clinics were so, and I do agree. I visited with both last week about this, they're going to have over the last couple of weeks. But it was seen across the board. So we hope that's the annual low, but don't know. Still, but
You see a lot of them, like, here, when I care, like, I say, they're busy and active in January. We running a family, like, we did home for the October, being at that for. But I didn't tell something drastic has happened to say, oh, what else are we doing? Sure. We got pretty difficult for people.
well, it used to be.
This is not.
We have not experienced that the last 3 years specifically, where, as an example, November and December specifically used to be the colonoscopy months for police docs, but first kind of stayed throughout the year. But now they're calling in January.
Yeah.
And not the exact mission line.
But it's that population talking about,
Correct.
like, they're not having exposure, so.
That is Medicare.
Yeah.
Yeah.
So you get it, fix it, you can start it.
The whole idea is that over 12 periods, we will come back
Exactly.
and then you will have. It's just interesting to us as we discuss it.
Sure.
That it has changed a little bit, specifically in the last 10 years
Yeah.
for us. Surgical. And I don't know. If and we are seeing, we're seeing more of that population, for sure.
Yeah.
You know, the hard thing is that you guys are seeing the area we see on the ruling system, but
Yeah,
this is what you have to do.
that's right.
You try to collect it, right? So we have it there, and so it very well, you know, the index that we see on the action can also be a result of, I mean, there's also some need to do, right? And we talked about that later, that it was like a bit, you know, the time.
Okay, any other questions? Next question, okay. Motion on the consent agenda.
Make that motion that we, it's interesting.
Been moved by Clint, we approve the consent agenda. I guess I need that, did anybody want any, take it out, we've already asked all our questions. So I don't think we need to. Okay, I need, anybody second? Mindy seconds. Any further discussion? All in favor? Any opposed? Okay. Then administrative reports, CEO report.
Yeah,
Danny?
thank you, Mr. Chair. Just really quick comment.
Hang on one second.
I'm sorry. A resolution, the first the resolution.
Oh, you're right. I did have that checked. Resolution Board of Trustees, North Lake County Hospital is supporting the creation of a. I need a motion on that. I assume you want a motion to approve that. I haven't read it yet, but it's say. I can't get my computer to function,
So
so
I think that,
I have no idea.
I think the intent is you wanted to make sure that there was a discussion with the board about the EMS district and what the board's position is. Before we did anything, we wanted something official.
Yeah, so what's the resolution I can say?
That we would encourage the
Please.
county commissioners to create a special service district to provide emergency medical services. Start Valley Health Authority for Lincoln County Board of County Commissioners. Engage with Start Valley Health colleagues and providers, stakeholders, public, for transparency, collaboration, profit. Start Valley Health. That includes the high quality, effective content that is sustainable.
Okay. We have a motion to, approve that resolution on the board, or do you want to change it? Okay, let's get it on the table and talk about anybody get a second. The motion is to approve by Ashley and seconded by Clint. Discussion on the resolution or the EMS, I don't want how far we're going to go with the EMS district. Is this board supportive of the EMS district? That's what this is saying.
Like, that's all I need to say, yeah, I like how that works out. That's another. Yeah.
Okay. All those in favor of the resolution? Any opposed? I assume that authorizes me to sign that resolution also, right?
Yep.
Might add that to the motion. Okay. What else did I miss? I'm up to date. Thank you. Now let's see your report then.
So you'll see this afternoon, the way that we feel about Star Valley Health is we have a lot of good things going, but we have a crap financial situation we're dealing with. I don't know how else to say it. Yeah. Kevin's. So when you're going to see our patient engagement scores, satisfaction, fantastic. You're going to see, and many of the board members that attend the quality committee, the quality outcomes, patient safety standards, fantastic. We did a presentation on employee engagement that was up in all areas.